Whatever you're funny, Peacock's got it exclusively. Bears beats The Office on Peacock. Stream every moment from Dunder Mifflin and explore bonus extras and exclusives. Plus, if you're looking for more classic hits, you can stream every episode of Parks and Recreation, 2.5 Men, and every season of SNL. In the mood for something brand new? Check out Peacock's original comedies, The Amber Ruffin Show, and Saved by the Bell. Whether you're craving a new binge or familiar fave, you can find tons of comedy hits on Peacock. Get started for free at peacocktv.com.
Children's National Hospital in Washington, D.C. improves children's health by developing better treatments and technologies. As one of the top children's hospitals in the nation, we take on the most complex, rare, and life-threatening conditions because all children deserve a healthy future. And with our new pediatric-focused research and innovation campus opening this spring, we'll be able to generate and share even more discoveries. Learn more at childrensnational.org/innovation.
Welcome to Beverly Hills Plastic Surgery Podcast. This is Dr. Jay Calvert once again from the beige couch in Beverly Hills with my co-host and soon to be educating me on the operation I'll be doing shortly, Millicent Ravello. How are you, Dr. Ravello?
I'm good. How are you?
Do you want to talk to me today about hip dips?
I would love to talk to you about hip dips.
Good, because evidently I'm going to need this knowledge.
Yes. So hip dips are not everybody has them, but sometimes it is the area of concavity on the side of the hips, below the hip bone, but above that femur bone that sticks out to the side.
Above the trochanter.
Yes, doctor. That is the name of it, the trochanter.
It's called the trochanter.
It's the trochanter. But if you're not familiar with the terminology trochanter, it's that bony prominence that sticks out on the side of your hip.
Very good.
So it's between that and the bony prominence of your actual hip bone.
The iliac crest.
The iliac crest, the ASIS, doctor.
So that is the hip dip.
That is the hip dip.
That concavity.
And in some people, it can be subtle. In other people, it can be really extreme, where they have usually fairly prominent hips, like bony hips that you can see, but then there's this big concavity before they get to the kind of fuller part of their thighs and their hips. Whereas it should be sort of a nice curve that goes from the waist to the hip and then down to the thighs. It should be nice, one smooth curved line. And when you have that dip in between or right smack in the middle of that hip line or that curve, that's what can be disconcerting. And those are the hip dips. And usually it just has to do, it can be seen in super skinny patients. It can be seen in larger patients. It really just has to do with your own anatomy of your bones, your bony anatomy, and how the angles of your pelvis sit. So that's all it is.
But people want them filled.
People want them filled because, especially if you're wearing anything kind of body conscious, so whether it's tight pants or really where you notice it is in a tight dress or a tight skirt, it's a visually disconcerting thing to see a small waist, hips coming out, and then this divot, this dent.
Like somebody took a sand wedge to your hip.
That's sort of ruining that nice curve to the hips. So that's why people generally like to have it filled in. Now, it can be filled in to a very small degree just to give you that nice natural or even flat contour to the hips, or it can be filled into an extreme, like if you're doing an actual Brazilian butt transfer or gluteal fat transfer. That's an area where people actually really blow up their hips. And in that case, it's not really called hip dips anymore. That's really where you're blowing out the sides of the hips to give you a super exaggerated hourglass look. That's not this. This is just to sort of fix that little contour deformity and make it more of a smooth surface.
Well, let me ask you a question about that, because correct me if I'm wrong, but that area doesn't seem to me like it'd be very friendly for fat grafting. Like, I think there's some big, thick fascial layers there. Like, what layer are you getting the fat into? Is it subcutaneous?
It's subcu.
Yeah?
It's subcu. So between the subcu and the underlying fascia, or the TB band or whatever's there.
It kind of glides there.
Yeah. There's just totally a space for it.
But could it get lumpy bumpy?
I don't think so. I think the skin is thick enough there.